Hi everyone. Sorry that it looked terrible, which is nothing new for me. I went to bed with wet hair, so this is the outcome. Anyways, this is gonna take me a little while to get through, probably. Um, yes, I seem depressed. Excuse me. Um, I'd like to share something. It's gonna be hard for me to get through, but I'm gonna do my best. So sorry if I pause or have to edit. Um, as most of you know, I have 2 cats and 2 dogs. Well, my male cat, he was 3.5 years old. The last couple weeks, he wasn't acting right, and then I noticed that he wasn't eating or drinking much. His weight started to drop. Um, he became very weak. He wasn't active anymore. He wouldn't come up to us wanting us to pet him or anything. We would have to go to him, and he enjoyed us petting him, but he just kind of slowed down. And I thought that because I flea treated them, that maybe the flea treatment poisoned him. That was not the case. Tuesday, sorry, looking at the calendar. Oh, June 6th, this Tuesday. Probably should have went to the vet sooner, but we took him to the vet. We called the vet that we use, and they were completely booked, so they gave us 2 other vets to call, and we got into a different vet. They were really busy, but they squeezed us in after surgery. He had lost weight. He was a heavy cat. Within a week's time, or a week to 2 weeks, his weight dropped down to 5.6 pounds. He became very weak, very, very thin. His fur, his coat wasn't looking right. It was soft and fluffy, and it just became, I don't want to say brittle, but it just became different. He stopped grooming himself. He would drink very little water, very little food, and then the last 2 to 3 days, he wouldn't drink or eat anything. He would go to it and stare at it, but he wouldn't eat it. And we would put a little water on his nose and kind of on his mouth a little bit, and he'd lick it off, but that was it. Food, same thing. He'd kind of lick at it, but wouldn't actually eat it. Anyways, we took him to the vet. His skin was yellow around his eyes, his gums, his tongue, his lips, his nose, the bottoms of his feet. Any skin that you could visibly see was yellow with jaundice. She said that that could possibly be his liver, but she wanted to test him for feline leukemia first. If that test came back negative, then she was going to do regular blood work and possibly x-rays. So between all these tests and the office call, they quoted us at $304. We had to put 150 down before they would do any test. So we gave 160 down. She said that the test would take about 40 minutes. She said we could stay or we could leave. Well, we were already upset. I knew it was going to be bad. So we left. We went driving around. She called us while we were in the car, driving around on the back roads, and said that he tested positive for feline leukemia. At that point, I lost it on the phone. Dan was driving. We come up to a stop sign. We sat there for a few minutes. She told me that the only options for him, because he was so dehydrated, was that, but there was no guarantee that they could put an IV catheter in him, but she said there was no guarantee that they could even get that in because he was so dehydrated, and give him IV fluids and nutrients, tube feed him to get food in him, and hopefully that would get his liver and kidneys and stuff working again, and give him medication. And she said that would take, they would keep him, she said, for like 2 to 3 days and see if that would help him. And then if it helped him, we could bring him home, but he would have to go through vaccinations. He would have to go through oral medicine. He'd have to go through a special diet. He could develop cancer. He could develop seizures. All these different things could develop. He could possibly develop tumors. Just all these other health issues we would have to look at. So I asked her, I said, what would the estimate be to keep him for a couple of days and see if, he could be, his health could be improved. He would never get better, but to see if his health would improve. She said, let me put you on hold, let me get you the estimate. And I said, well, I said, just give us a few minutes, we'll come back to the office and we'll discuss it. She said, okay. So we went back to the office, and the vet and the vet tech explained what was going on. And they said that, to be honest about it, as bad off as he is, that they, sorry, accidentally paused. She said that as bad off as he is, she don't think that the IV and the force feeding and the medicine and stuff would work. He was very, very weak. And about all he could do was twitch his tail, and when you pet him and stuff, he would pick up his head and he would push his head into you like cats do, wanting you to pet him more. But as in walking and stuff, he was walking, but not very well, because he was so weak. So she discussed with us a little bit about what the leukemia is and all that, and excuse me, she said that, I need a drink, hold on. See what it is? It's an emoji. Poop. In other words, shit happens. It's coffee. anyways, she discussed it with us, and I asked her if she ran his blood work to find out how severe his organs are damaged, and if his organs are not too far gone, could we try the IV and stuff. But she said it was all they could do to get the blood from him, so she didn't think that as small as his veins were, that she would be able to get the IV catheter in him. And the way he fought them when they did the blood draw, she didn't like that because, you know, he's already stressed out from being sick, and then he was stressing out from that. And so anyway, she said that, or she brought him back in the room. They had him on a board with a towel on it to carry him and make him more comfortable that way than trying to, you know, hold him and stuff. So he laid on that board, and every now and then he'd roll over and he was flopping his tail. But while they were carrying him on that board, he never tried to get off of the board. While the board was on the table, when we were sitting with him, talking to him, petting him, and talking to the vet, he never tried to get off that table, and that's not like him. He's the type of cat that you can walk up to him and pet him. Excuse me, that was rude. But don't pick him up. It like all on his terms. He was a nice, lovable cat, but everything had to be on his terms to pet him, to hold him, whatever. But anyway, he didn't try to get away from the, or like get off the table or nothing. And so there was 2 chairs in the room, and we pulled up 2 chairs around him, and I was petting him on his head and his neck and his feet and stuff, just petting him, talking to him and stuff, wishing for the best. But anyways, she said it would be 40 minutes to run the blood work, because they didn't do that part because he tested positive for the feline leukemia. So she went back, or we sat in the room with him and talked to him, petted him, cried over him, and trying to figure out what we were going to do at that point. So she come back in and she said the blood work will be done in 5 minutes. So she come back in with the blood work, and there was something on there, I can't remember what it was, that was really high. It was only supposed to be at like 6.0% or something, and it was at like a 10. So it was way over here in the red, in the high. And then in the middle bracket, from the front to the end in the middle is normal. And then on this side, in a little bracket, is low. Well, he had one that was over here in the red, nothing in the middle, and everything else was all the way over to the edge of the paper, to the low range, where if it would have been any lower, they they wouldn't have been able to get a reading at all. So his kidneys and his liver and his pancreas and stuff were just about gone. His blood pressure was so low that it was like he didn't even have blood in him. He was severely dehydrated. His white blood cells and red blood cells were the count was so low that they almost couldn't get a reading on it. Because with leukemia, it attacks your bone marrow, but then your blood cells like eat each other or something, so to speak, and it makes your blood count drop. So anyways, that's what's going on, or what went on Tuesday. And the vet said she wasn't telling us what to do, but she said in the best interest that it was probably best to put him down because he was suffering. He would suffer through, if they could get an IV catheter in him, he would be in the vet's office suffering for a couple days as they try to make him better. There was no guarantee that he would get better because there's no cure for this. Once a cat has it, they can sustain it with medicine, but there's no cure. It will not go away. So she said that he'd be suffering the rest of his life. And because we have another cat, chances are that our other cat could get it under certain circumstances or whatever, and so we would have to keep them away from each other or get rid of her, and I didn't want to have to do that. So, but anyways, I wrote down some facts and things about it. Sorry this video is so long. Hopefully YouTube will let me post it, because it's over 15 minutes. But anyways, I wrote down some facts about it, so don't mind that I'll be looking down at this paper. Anyways, feline leukemia is transmitted from infested cats by saliva and nasal secretions, which is very rare. Sexual contact. Some cats fight it off, and others it attacks the immune system. Can cause cancer in the cat. So that was a concern. It causes loss of appetite, which Gizmo had, poor coat condition, which he had, dilated pupils in his eyes, which he had, bladder issues, seizures, swollen lymph nodes, fever, weight loss, which he had the weight loss, anemia, diarrhea, jaundice, which he had jaundice, and a wobbly, like when dog's coughing. Get a drink of water, girl. Wobbly, like when they walk and stuff, like they're drunk or something. Cats will show no signs for several years. Some cats can fight it off, but they can fight it off. But if they do a test to test the cat, it'll show in their system. Fighting it off means that their immune system is keeping it at bay. And the cat will stay well, but can give it to other cats. The virus has 6 stages. The virus enters the cat through the mouth, which would be like through blood, like if a cat fights with another cat or things of that sort. And then it grooms itself or grooms the other cat. And it can enter the body through, sorry, my ear itches, through sexual contact, and it'll attack the blood cells. Stage 2, once in the blood, it spreads through the entire cat's body. Stage 3, the lymph nodes become infected. Stage 4, virus takes over the body's immune system and organs and intestines become infected. Stage 5 attacks the bone marrow, which that's what happened in Gizmo, but it just happened so quick. He wasn't showing any signs or symptoms of anything wrong with him up until a week to 2 weeks before he got sick. And that's what it does. Some cats, it'll hit them really fast, and then other cats, Other cats, it won't. Stage 5, attacks bone marrow, I already said that. Stage 6, cat's body is overwhelmed and all organs are attacked. Can be spread by biting another cat and having an open sore, blood to blood or blood to mouth contact, like AIDS in humans. Some people call it AIDS in cats, and so it's a blood to blood thing, sexual contact, things of that sort, just like AIDS. Humans and other animals cannot get it from cats. So, if you have a dog or another animal, the animals cannot get it. All cat species, lions, tigers, cougars, jaguars, things of that sort, cat species are the only ones that can get the feline leukemia. Dogs and humans cannot get it. They have leukemia that we have and the dogs have and stuff, but this leukemia, we cannot get it from the cat. Humans, dogs, other animals. 0.5% of 0.5% of cats are infected. Kittens can get it from the mom while the mom is pregnant, and that is, the vet asked questions about the mom and the dad of Gizmo, and most likely that is how Gizmo got it. His mother shows no signs or symptoms of it, but a cat can have it without showing any signs or symptoms of, the infection, unless they're tested for it and it shows up positive, and then they can be given medicine for it, but it can still become active later on in the cat's life. So kittens can get it from the mom while she's pregnant. If diagnosed early, most cats die a few months later, or if not active, they live longer. There's no cure. Vaccines can be given only if the cat tests negative, but it does not protect the cat 100%. The virus has been around since 1964. The first vaccine for it was in 1965. Not all cats in the litter can have it. So in his litter, I believe there was three or four babies. Let's see, Gizmo, Tiny. There was 3. He was from the mom's second litter from my parents' indoor-outdoor cat. So he was born with it, no doubt. The first cat, Tiny, because they were born inside, my parents were letting him go in and out. He got in a fight with another cat, and got severely hurt, and he died. Fluffy, the female, she was going in and out, and all of a sudden she was acting like she was poisoned, and they went and bought some medicine and stuff and was giving it to her, and made a vet appointment, and before they could get her into the vet, she passed away. And now that I think about it, she probably had it too. And the acting poison was because her body was shutting down and this and that, and so I don't think she got poisoned. Now that I think about it, she probably had leukemia too, and I didn't really know about this until now. So some cats show no signs of the virus and live a long time before signs show up, but can show up when they're tested. Make sure or males are more likely to contract the infection than females. The cat can get tumors if caught early or before signs and symptoms. The cat can be given medication. If severe, blood transfusions can be done if the cat is strong enough, which Gizmo was not. IV fluids and feeding can also be done if the cat is strong enough, and he was not. Special diet may be given. If caught early before too severe, the cat can live 2 to 3 years. Like say you have a cat, you go to get its vaccinations, you tell them you want it tested for that before you get the vaccinations, and the cat has no signs and symptoms of it. They test the cat, it comes back positive. Okay, they can give the cat medication, even though there's no signs or symptoms, they can give the cat medication for it. And a lot of times, because of catching it early, the cat will live for 2 to 3 years before it shows any signs and symptoms of it. So, but not all vets, when they vaccinate, when you go there, will test for it or ask if you want tested for it when you get your shots. And I think that they should ask you if you want your cat tested for that and explain to you what it is. But they say that your cat should be tested. That your cat should be tested for it before it gets the vaccination for it. Test it as a little kitten and then test it again, because I guess the vaccination will not protect them 100%. And they say it will not protect them 100%. So the vaccine lasts for, I think they said 2 or 3 years. So they said to have the cat tested. All they do is draw a little blood. It's a little wand, about like this, looks like a little pregnancy test. And they drop like 1 or 2 drops of blood on it. And 1 line negative, 2 positive. Sorry. Kind of like a pregnancy test, but it's with blood. So, anyway, so, if you have cats, leukemia testing is something to think about. We laid Gizmo to rest on Tuesday. Sorry. I didn't want to do it, but it was in the best interest for him because he was just suffering too bad. So, we have another cat here. She's fine, but we're going to take her and have her tested. And hopefully she don't have it. So, but anyways, feline leukemia is something to think about when you have a cat. Always have your cat tested, because you never know. They may have it when they're born, and then later in life, signs and symptoms show up, and it'll kill your cat. So it's kind of like AIDS in a cat. So hope this video doesn't bore you, but that's what happened, and I just want everybody to know that if you have a cat, have them tested before you put them with another cat or get their vaccinations, so you can catch it early. I wish I would have known about this before so that I could have caught it early with him, but he's had his shots but was never tested for it, so I guess not all vets will test him for it unless you tell them you want it, blood work done and stuff, and then that's one thing that they will one thing that they will do. So, I guess that's it. So, rest in peace, Gizmo. We love you. We miss you. And please remember, get your cats tested for feline leukemia.